Remember, there's different factors that are going to affect your low back. Now we're going over postural structure. And with postural structure, that means your bones, the position of your bones. Whenever you don't have the best postural structure of your joints, that creates different loads on the joints. So the whole idea is to have the forces of what you're lifting evenly spread throughout the body so that nothing's going into your joints. Kyphosis is when the upper spine begins to stiffen in a forward curved position. It sometimes pushes the shoulders forward in a locked position as well. During most pressing exercises, especially anything overhead, would be extremely challenging and increases risk of shoulder injury. A curved upper back will also put more pressure on your low back when you're deadlifting or doing bent over exercises. Any deviation from the neutral spine creates compensations. Most commonly seen is an anterior pelvic tilt. Your anterior pelvic tilt can be improved to a neutral hip position, but many pelvic tilts are anatomical. You are probably born with a more excessive tilt, which also means you cannot gain a neutral pelvic position. And if you do force it during exercise, you're more likely straining another area to do so. The best approach is to strengthen the muscles around your pelvis and your low back. Compressed lumbar is exactly what it sounds like. Your spine at the low back is compressed. When too much compression happens, it begins to pinch. This pinching is what you often feel as pain. The best solution for a compressed spine is to decompress it. The main reason it is compressed is because the muscles were not strong enough to hold it in place. So after decompression, you have to then strengthen your low back muscles. Our thigh bone can be compressed into the hip socket. Sometimes we feel the pressure in our low back, sometimes we feel it in our backside in the form of a sciatic pinch. Decompressing the hips and strengthening the muscles around it is the same fix as a compressed low back. Create space in the hips and strengthen it. Since the mid and lower traps in this forward shoulder position can't pull your chest up and your shoulders back, you are essentially working your back in a stretched position, which means it's compromising your low back and increasing the risk of injury. Thank you for watching, and stay tuned for the next video on sport-specific demands. A lot of times you will feel certain issues because of the specific movements you're doing or the specific sport that you're training for, so we want to make sure that the body stays strong and healthy and mobile for any activity and any sport. Thank you again.